Don't forget to click the subscribe button
and the notification bell
to see more of the Contessa's videos.
Hi, I am Kyle Celine Dorado from the last episode, and now I'm going back again to do like under eye enhancement procedure, because this is something that is genetically inclined and I want to improve my overall aura, and I always of course want to look fresh in front of the camera, and for that of course I'm going to ask Doc for that. And if you guys want to watch out for the procedure, please don't forget to like and subscribe on the YouTube channel, and of course follow them on their social media accounts and platforms, CSA Medical Aesthetics, and of course share the video.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up on the procedure we've done for her, the so-called chin augmentation using a modified technique, plus the masseter reduction with our toxin. Let's all welcome back Miss Casey.
Hi everyone, hello.
There you go. So you can see Casey today. Actually, the procedure done was 5 days ago. We did like filling in the chin region, and we made use of the cannula method. And right now, looking at her, actually, I don't see any sign of injections there, and it was just a non-surgical procedure. Okay, and I was assessing her masseter also. It's already smaller, so giving her a narrower
like 5
face.
days only.
Yeah, so it's an instant result, actually, fast result, by the way. So today, we'll be doing a so-called under eye treatment. And looking at Casey, as you can notice, her under eye has this so-called tear trough deformity, actually. And she mentioned that it's genetically, or rather, it was inherited. Okay? So, it's inherent already in Casey's genes.
Yes,
okay, so assessing her under eye region, we noticed that in the medial canthal region of the eye, going towards the infraorbital area, so there's this hollowness. It's sunken, it's deep, and meaning to say some tissues are lacking, or rather the, what do you call this, the under eye region has a thinner tissue layer. So what we're gonna do today is to correct that, to improve that. So as Casey mentioned in her intro, she was saying she wanted to improve her aura, her looks. So actually, we call it the look. So right now, because we're wearing face masks and people are looking at our eye region, so we wanted to beautify the eyes, immortalize the eyes. Of course, we wanted to make Casey look fresher, okay, every day. And of course, she's going into this journey of joining a pageant. So we really have to make her look her best. Okay, so what kind of treatment, what product material are we going to use? Let's all watch that when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So, looking at Casey right now, so our concern is the under eye area, the hollow under eye. And we've mentioned that the cause of this for her case is genetics. So she inherited this. So she has these deep set eyes. Okay, other people will just acquire it, like their lifestyle, lack of sleep or stress, fatigue, or others will have this history of allergies, like allergic rhinitis and other types of allergies. They have this problem under the eye. And if you notice, there's like a dark shadowing. So creating that dark circles or panda eye. They call it panda eyes too. Okay. So, well, other causes could be some medical conditions or drug-related, aside from those genetics, lifestyle, or history of allergies. Okay. Now, in terms of assessing the under eye for doctors, we need to, of course, know our anatomy. Okay. So, the anatomical layers, the skin, the superficial fat layer, and then there's a muscle there, and there's also like a deep fat depending on the anatomical region, and also the bony layer. So those are things that we have to remember, and which anatomical plane should we insert our product material. Take note, we're doing non-surgical procedure here. So before you do that, of course, cleanse the area. Then we did apply topical numbing cream, and then right now you can see this brownish color here. This is a betadine. And then my material, of course, would be making use of our hyaluronic dermal filler. So as you all know, hyaluronic is a natural substance. We find it in our body. It's a so-called water polysaccharide. It attracts water, and it will improve the under eye volume plus the skin texture, and will give that radiance. Okay, and later on I'll be adding my so-called PDO or polydioxanone threads to stimulate collagen synthesis. So it's gonna give a long-term effect of rejuvenated eyes. Okay, so for my hyaluronic dermal filler, I'll be making an entry point because I'll be doing the so-called cannula method. Okay, so I just make a diagonal line from the medial canthus towards the lower cheek region, or for those who wanted to find out how do you do the markings, so vertical line from the lateral canthus, and then diagonal line from the medial canthus towards that, and that will be our entry point. So just make a tiny puncture. I'm using a gauge 21 needle, and I have my Bellotero Soft here. I love the Bellotero consistency because it has very good cohesivity and there's a good tissue integration. So it's gonna be homogeneous in the under eye region. So I have a cannula here that's gauge 25. And again, I'm using the so-called Bellotero Soft, and then you glide it towards the under eye region. My anatomical layer is submuscular because when we smile also, the muscle under the eye or around the eye, the orbicularis oculi muscle, when it contracts, it pushes your filler when it's placed on top of the muscle, creating that effect of like a bump or a lump. So it's better to be under the muscle because that orbicularis oculi muscle is actually very superficial. Okay, so I'm adding a little bit into the tear trough region. So I'm doing a micro aliquot, small dose, small amount only, slow push, and it's a so-called linear retrograde technique. Okay, there you go. So Casey is very young, actually. She's just 19. So her case is more of a genetic predisposition. So at this age, you can start already correcting such problems non-surgically. Since you're young, we wanted to do something, a procedure that's not really very invasive. Okay? So for her case, I will also add my polydioxanone threads because I want her skin, the dermis of the skin, to synthesize more fibers to create protein structures there with the help of our PDO threads. PDO threads are very effective in giving skin rejuvenation, regeneration, collagen formation, and actually there's also a brightening effect from these PDO threads. So I'm just making my injection of a lidocaine on the inferior aspect of the lateral canthus of the eye. So I'll be using the so-called derma spring. So this is polydioxanone, and it's just inserting towards the medial canthus area. So it's a quick procedure here, but of course we have to make sure that those who will do this for you are really trained aesthetic doctors. So there's a training for this. it's not a short training, it's a, of course, the learning curve is not that kind of steep, or you have to really take time to learn this. Okay, and make sure that the products you use are well studied, scientifically studied. Like for the dermal fillers, I've been seeing fillers in the social media that they post and cost is very cheap. So be careful with the kind of fillers you're using for your face. Make sure that they have scientific data or clinical studies, because we wanted to have product materials that are really approved by our FDA, and of course they have been like checked or really tested for a long period of time. Okay, because in our clinic we only trust, for example, the brands of Restylane, the Juvederm, the Belotero. Those are the brands that really had a lot of scientific studies and long-term safety track record. If you see those brands, or rather they were saying filler for only like a very low price, you have to do your research. What kind of filler is that? Because the well-studied fillers, the brands that we have, of course they have a certain amount. It's not that well, I don't say that it's that super expensive, but it's something the rate is reasonable. Okay, so really do your research, really do your study. The injector that you will go to, you should also do a background check on them. Okay, so we're done with our right side. We'll be proceeding to the opposite side. So we're doing our left side now, and again the same procedure, same technique here. We will make our entry point here, and I'm using my Belotero Soft, a cohesive polydensified matrix technology, and we're inserting the cannula towards the medial canthus. So we will be filling in this hollow area here, and again my anatomical layer is submuscular. Okay, there's some pressure there. Okay, so I'm using a gauge 25 cannula and filling in. So my technique is a linear retrograde technique, and I am using only very minimal amount of our dermal filler in the tear trough. We don't want to overfill it because the filler is a water humectant. It will still absorb water, so we don't want to create lumps and bumps in the coming weeks. So we'll advise Casey to drink a lot of water to help hydrate the skin under the eye. Okay, so we just want to give like tiny amount. Actually in this region you can give like 0.1 to 0.2. That will be enough. So no need to overfill, because if you overfill, then in the coming weeks she might notice the so-called bumps or lumps, or like a sausage shape under eye appearance, or like giving her more eye bags. Okay, so I'll also proceed to our thread insertion. Okay, for those people who don't want to have under eye filler, your alternative will be your volumizing threads, because this will help in making new collagen fibers and other fibrous tissues, because your threads, actually your threads are absorbable types of threads, and in 3 months time you are stimulating our neocollagenesis. So around the thread there will be new fibrous networks developing or forming, and while your thread is being absorbed, then the network of fibers will be left, so that will be helping in regenerating your skin. Okay, we can just insert through these entry points here. My derma spring is in a cannula, so the PDO thread is loaded in a cannula. So this is not a needle, this is not a sharp needle, because we don't want to induce a lot of bruising there. Okay, actually when you make your puncture, expect some pinpoint bleed there, because we made use of the gauge 21 puncturing needle there for our entry point. So I'm using my second derma spring. Okay, so just do a direct pressure there so the bleeding will stop. And then advise them to do ice compress for the first 48 hours. So I am on my third Dermal Spring PDO thread. So when you say spring, it's like the threads are arranged in a spring pattern. They are like in a coiled preparation, or rather in a coiled pattern. So I am on the fourth one. So we have like an entry point here where my cannula loaded with the Dermal Spring thread is being inserted. It's just because I use so tiny puncturing needle, that's why there's some resistance or like an effort to insert the thread. So actually, if you want, you can make use of the bigger size needle for you to have an easier entry. So we're done with the under eye filler injection and the Dermal Spring insertions. We'll show the result to Casey when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So we have done the under eye treatment using our dermal filler as well as the PDO thread insertions. Now we'll show the result to Casey. Casey, ito na po ang ating mirror. Look at your under eye right now. Okay, yeah, wow. So actually I can see an instant result right now whereby the hollow area was filled in. So we made use of the Hyaluronic, our Belotero Soft, to fill in the sunken part. So instantly with your filler injection, you can already see the immediate elevation of that depressed or sunken area. So we wanted to clear the skin as well, and of course eradicate that dark shadowing effect. And I did not inject too much of the filler. I only use a minimal amount, so we don't want to overcorrect it because it will still change. So as time passes by, you will still see an improvement in the skin, plus it will still plump up or further volumize. Just drink a lot of water. And then the polydioxanone threads will stimulate collagen formation or also angiogenesis, as well as tightening and firming of the skin. So it's also anti-aging. It will prevent the sagginess of the under eye region, and it will maintain the firmness and tightness of the skin. And it also has a brightening effect. So this is a combination filler as well as polydioxanone threads. For those individuals asking, is it safe or is it okay to combine the two? Well, hyaluronic, again, is naturally present in our system. So it's a water polysaccharide glycosaminoglycan, amino or protein, short peptides with some of the sugar component. And then the polydioxanone, poly meaning many, dioxanone, okay, so these are also safe materials in our tissues. They're very biocompatible. There will be no interaction between the hyaluronic and this polydioxanone that we applied. And we've been doing this for a long period of time. And this is more of skin rejuvenation, skin regeneration. So we're not really doing the lifting effect because I don't combine filler and thread when I wanted to do a face lifting technique. But if I want to do at the same time, we insert it at a different anatomical location. So for those doctors asking, when do I combine it and when I do not combine it? So case-to-case basis, okay? So let's hear it, or let's listen to what Casey would say.
It really improved the tendencies of actually having like sunken eyes or deep set eyes is actually that you tend to look a bit stressed, or like you have like lesser of sleep, which is something po na hindi ko naman ginagawa. It's just because of the genes that I naturally have these eyes. Now that I'm looking at it, parang it really gave this fresher look to me. Like I look like my age.
Yes, she's just 19.
Yes, I'm 19 years old lang po. So like I feel like my eye bags or like my under eye bags are really a factor of why I look more matured.
Yeah.
Ayun, now looking at it.
Nakaka-age yung pag-sunken under eye or hollow under eye, right? So again, take note, if you wanted to do treatments like this, if you're asking or if you wanna ask us or you're interested about these kinds of procedures, actually you can reach us at our email address, csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics. And just do your research again. I wanna really emphasize that the products that we use are clinically studied. They have evidence-based studies. So of course, these kinds of products are there in the market for a long period of time. And you'll see other types of dermal fillers they post on the web and they're so cheap.
Yeah,
Please be
at
careful.
A very low price, which is something that is very dangerous since marami na din pong kumakalat na petroleum jelly pala yung i-inject.
Yeah.
It's so scary. So
Yeah.
it's better to really like spend a bit more na alam mo naman na safe.
I got scared when you said petroleum jelly na pala. So please, 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 safety is very significant. You just wanted to, of course, this is not vanity. We wanted to improve our looks. It's part of our health and it actually has a psychological impact. So,
Yes.
of course, looking good, you'll feel good, right? That has something like, it will affect also our mental health, okay? And plus, of course, our daily activities, we become more productive, right? With enhanced look. And I can really say it's part of our health. Yeah. Really, natakot ako baka yung iba petroleum jelly pala tapos very
Yes,
cheap.
marami na pong cases na ganun actually. Like, they go for cheap prices. Syempre, the people are gonna go after some of the cheapest talaga in the market. And then,
but
ganun na pala, petroleum jelly na
yeah,
pala.
it will create a lot of complications, And then if there will be complications, they will have to go to doctors, go to emergency rooms, go to hospitals. They'll spend more. So, mas gumastos pa sila.
True, opo.
So,
At first po kasi, it will create the look like the filler talaga if you're going after. But then later on, pag nagsisettle na po siya, doon na po nila mararamdaman yung effects talaga. Since it's really not safe.
those are the ones that I see, dun sa internet, yung what happened to their cheeks. Parang nag-expand, nag-enlarge. I think what they're doing with the petroleum jelly, they heat it up and then it will melt. It's gonna become like a liquid. O nga naman, when you inject it into your face, like cheek, chin, tapos at first parang kita mo plump up, And then over time, yung gel na yon, yung petroleum jelly na yon, syempre it will harden inside, right? And
Yes,
it's a foreign object. It's not even biocompatible. It's not tissue friendly. It's not gonna be healthy for the tissues inside. So it will create, it's a foreign body. Our body will react to a foreign body. So there will be inflammation there. There will be infections there. So scary nga. Yeah. Ayan, so hopefully we were able to remind you or share inputs with you. So safety is very significant. Okay, thank you, Casey, for sharing with us.
Thank you so much.
I'm really so glad that we were able to help you, that CSA was able to help you looking at her face, the profile, the nose, the chin, and then the angle of the jaw, plus the under eye. Yan na. This is Casey version. Anong version na? 2.0?
3.0.
3.0! Okay, mas advanced pa. So, thank you so much. So, if you have any questions, again, you may email us at csaskinclinic@yahoo.com, FB page, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Marugul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. So when it comes to natural beauty, you can trust the CSA Medical Aesthetics.